Hi everyone, and welcome to this Hitachi Solutions webinar. Our topic today is metrics that matter with respect to safety analytics. I am your host, Dinah Kennens, and joining us today is our featured speaker, Rob Shillinger. Rob is the Business Intelligence Consulting Manager at Hitachi Solutions. He has over 15 years of experience implementing enterprise-wide solutions across North America for organizations in both the public and the private sectors. Rob's been fortunate to help customers use the information generated by the analytics solutions that his teams have implemented to produce notable organizational wins, such as shorter wait times in emergency room departments, improved service delivery performance for home healthcare providers, increased sales volumes and opportunity wins for corporate sales teams, as well as improved product margins for multinational distributors, just to name a few. We're very excited to have Rob sharing his knowledge with us today, and with that, I'll pass it over to Rob.
Thanks, Dinah, and thanks everybody for joining us today. I wanted to talk about a topic that's near and dear to everybody. It's really about life. It's really about organizational health and safety, and how it impacts our working life and really our life in general, and how numbers can actually improve the quality of the health and safety within any organization, public or private. It's a bold statement, I know, but as we walk through today's program and you hear some case studies of customers we've worked with, you'll understand the importance and the ability to actually influence change and create a more positive environment for health and safety. So let's understand the nature of the problem. Let's understand what we talk about when we talk about safety, health and safety and safety analytics. Lots of studies have been done around the impact of lost productivity and overall economic impact around health and safety issues. Recent study by a United Nations agency figured out that 4% of the world's GDP is lost due to death, loss of productivity, disease related to organizational health and safety. If we bring it back to Canada, 4% of our GDP is roughly $22 billion, which represents about 44,000 jobs. So if you think about it, that's a job for your mother, your father, your brother, your sister, that if we can improve health and safety within an organization, even by 1%, we'll create a giant leap forward in terms of just overall economic and social impact. But let's drill further into understanding the nature of the problem. So really, it comes down to a similar problem across a lot of organizational areas. It's being able to understand and develop programs to help influence and change your health and safety outcomes. And it gets down to the fact that a lot of the information around health and safety issues that happen, falls, accidents, machines that break, people that fall in a parking lot, they're collected in systems that are disparate. They don't talk to each other. And it's hard to put together information when they're sitting in silos. And it's hard to understand a root cause when you have these silos of information that aren't connected. So if you're looking for variables that will influence an environment to make it more safe, much safer, then you first have to put the information together in an accurate way and in a way that works for your business process. Another thing with that is if you look at information collected historically, that's really a lagging indicator, meaning you're looking in the rearview mirror and you're trying to figure out the reason why something happened. An area that should be focused on is trying to come up with variables that have an influence on the safety of an area, of an organization, and trying to change those variables so that the outcomes are where you want it to be. And really, why this is so important is if you think about health and safety issues that happen, they have a ginormous impact for regulatory risk, for your financial outcomes, your HR outcomes, You think about a severe accident will impact a stock price, it'll impact your ability to raise capital, um, it may impact your ability to retain or hire really talented people. If you're a regulated industry, then your ability to meet regulatory compliance is at risk. But let's understand at this point what can happen when you take a serious stance at organizing information around your health and safety outcomes and the art of the possible. So I had a client in a hospital who had a severe issue in their emergency department. A lot of patients were not being seen on time, and these patients were of a high criticality. And because they weren't being seen on time, the hospital was subject to a lot of pressure to improve its health outcomes. So they did a serious study of the complete process from when a patient walks into the emergency room to when a patient is discharged either into the hospital or discharged home or elsewhere. And they studied people's where they walked to, how long it took them to walk from A to B, the handoff points from the charge nurse when they check in to the first time they see a clinician to the last time they see a clinician on discharge, and they determined that the flow pattern wasn't optimal. People were getting in a sense lost in the shuffle, and so they completely redesigned their floor plan. They completely redesigned the stations of where people had to see which clinician, and because of that, not only did severely critical patients get seen earlier, their wait times improved, and so people were actually waiting less in general. And because of that, they actually received more funding from the ministry. But the real benefit to this was not only the healthier patients, but they also realized that some of the patients coming in shouldn't actually be coming to the ER. For example, they recognized a lot of diabetes patients were coming in because they weren't taking their insulin properly. So they developed an educational program in the community to educate people on when and how to take insulin. And because of that, the number of insulin-related events in that ER was reduced, meaning there was less people in the ER, meaning, again, wait times improved, the ability to see critical patients improved. This was done because they established a programmatic view of the problem. They established clear accountability lines at each level of the process. And they were very rigorous about capturing, maintaining, and combining and integrating their data so that it made logical sense when combined, and they could use it to trace flow patterns from start to finish and come up with a solution that we just talked about, which obviously improved their economic outcome, improved their operations, and reduced their regulatory risk. So taking a programmatic view of this is very important, and we'll walk through some of the steps on how to get there. So if I think about some of the areas that we need to improve on, it's really, there's really four main areas here. One, we need to set an accountability structure around health and safety within an organization, and that's from the top down, from executive sponsorship all the way down to people responsible for their own specific areas, and that with clear understanding of goals and targets and the processes to achieve those. And with that, we need to establish an ability to collect, package, and integrate the data so that we can make these assessments. And that usually comes in the form of combining information from different operational systems, ERP systems, financial systems, spreadsheets that may be capturing other information, and put that together so that we understand, again, the flow patterns, the business process outcomes and transition points, so that we can understand A, what factors go into health and safety issues, and B, what factors can be influenced to change and make these outcomes a lot better. The next thing we need to do is A, we need to look backwards and see why things happen, but B, we need to also look forward and come up with a set of hypotheses, a set of questions to try and determine what are the main drivers of our health and safety outcomes, and what variables can we change or influence so that the outcomes are better. And that really goes down to a level of predictive modeling. By changing the variables, by changing the weighting of the variables, we'll come up with a model that's going to make sense for the organization or the area of the organization that's in focus. And then fourth, really just setting a set of practical targets around your outcomes so that you can monitor those, take action as needed. And that also means that we need to create a set of easily accessible data and easily accessible visuals, reports, dashboards, so that somebody can actually take a look at the outcomes on an ongoing basis, in a sense, a real-time basis, and be able to understand that, oh, there's too many falls on that floor, so I may need to change my maintenance routines. I may need to add or change my nursing staff. And that's actually a real story. A client of ours noticed a severe number of falls were happening on two of their floors in an old age home, and they studied the problem for a while, and they studied flow patterns, the nature of the patients, the patient's health state, mental state, the number of nurses, and they determined that it was caused by too few nurses, and the floor itself is actually far too slippery. The material of the floor, when cleaned and even when dry, was far too slippery. So they changed the nursing staffing schedule, they changed the floor itself, continued to study it, and the number of falls went down, the health and safety of the patients went up, and they continue to monitor this, and they actually use this as a way to create an overall health and safety program for the entire facility, and they've seen some additional benefits in that in terms of decreased nursing sick time and improved patient and resident safety. And there's so really, if you think about across public and private organizations, the ability to take one example and elaborate on it and create an overall organizational-wide program is another area for improvement. You create a success with one small pilot project, and that will then create an overall organizational imperative to take this programmatic approach. Which leads us to an interesting question, so what are the leading organizations who have a programmatic approach doing about health and safety? Well, there's a really good example of a mining company that experienced some unfortunate deaths in one of their mines. And again, like the other two examples I talked about, the hospital and the old age home, they began to study all the environmental variables related to these deaths. They studied the miners, their education, their health status, the physical nature of the mine, the process of entering the mine, working in the mine, leaving the mine. And they actually came up with some information that was counterintuitive. They actually came up with information about what was actually creating these accidents that wasn't what they thought in the first place. And because of that, they implemented structural changes to the mine, structural changes to the health and safety programs in place at the time, including increased education and increased supervision of the miners. And over time, they saw the rate of death, they saw the deaths fall to near zero, which is great. But again, it shows you that this programmatic approach to analyzing data, the environment, and creating clear accountability structures were really the keys as to why they were able to see the benefits. And really, what this also points out is an approach to health and safety analytics, an approach to health and safety improvements, is part of an overall strategy for an organization. It's one of their key goals. Again, health and safety will impact your operations, your financial perspective, your reputation, your ability to hire, retain staff. So you want to take an overall organizational view of this, bake it into an overall information strategy, accountability strategy, and an overall data governance strategy, so that you're able to create a clear set of communication and responsibility, collect, monitor information, and be able to act on it, and not only act on it, but also use it in a way to try and forecast the probable nature of future events happening. And by doing so, and again, starting small and creating that to create an overall enterprise-wide program, you too can see the same benefits that I've spoken about. So, which leads to an interesting question is, how do you start? How do you begin this journey about improving your health and safety outcomes? What questions do you ask? It really begins small. You look at one area that might be the number of falls. It might be falls in the parking lot. It might be it might be increase sick days during the flu season. Study all the data that's collectible about that environment, about that situation, about the outcome. Create a data environment where the data is put together, integrated, accurate, and follows the business process and rules in place. Use it to look at the variables that are connected to the outcome, and how do you change them. For example, in the case of falls in a parking lot, perhaps you need to increase the number of times you shovel in the winter. Perhaps you need to increase the amount of de-icing you do. With that, and by seeing a positive outcome, you can then take that as a success to create an overall organizational-wide program. The questions you ask around health and safety will be the same across all organizations, public and private. The nouns you may use inside the questions may be different, but it's all about people's ability to carry out their job in a healthy and safe way, so that they can be productive and meet their performance targets. And anything that blocks them will not only block them, but block organizational goal attainment. Again, could lead to reputational, financial, and operational risk. So you want to focus your questions on, and your analysis on, outcomes and the conditions and variables that influence that outcome. And there are a number of KPIs that we can look at, a number of measures, a number of outcomes that we can look at to try and understand, monitor, and assess our health and safety program in place. And they're all related to the safe performance of our work functions, and they're also related to gathering information that you can use to again be able to predict the outcome of what's going to happen. We have another client story that's interesting. So they saw an increased number of safety incidents across our organization, and they recognized that in order to create an accountability structure, a level of awareness and cultural sensitivity, they've done a few main things that are very interesting. One, whenever you visit any location, everybody who visits must watch a safety video. It's mandatory for anybody and everybody who visits, and you must sign off on this, and you must do this every year. Two, at the beginning of every meeting, they have a safety moment where they remind people about safety protocols in the specific area. So that, again, this is an ingrained part of their culture. And three, they actively collect, monitor, and analyze the safety outcomes of their key programs to ensure that what's in place is working and make changes as needed. And they've seen the level of safety incidents decrease dramatically over the years this program has been in place. And they're not a small company. They're a multi-billion-dollar international company who took it to heart to improve their safety outcomes. And so you can see that large or small, a programmatic approach to this will create a success. So just a few takeaways, just a few things to think about as we conclude or near a conclusion of our presentation. Health and safety outcomes are a key part of every organization, public and private. The ability for us to influence our outcomes is actually great if we can understand the nature of the environment and the outcomes and potentially the problems, which means we need to collect information actively, house it in a way that it's accurate, that it's updatable, which generally means creating things like data warehouses and data marts, creating visualizations that are easily accessible, that are easily understandable in reports and dashboards so that people can monitor current state and also look at ways to try and forecast future state and change environment or variables that will impact the health and safety outcomes. And most importantly is create an accountability culture and a sensitivity from the top levels of the organization and all the way down and up again, so that people understand their role, their responsibility, and their targets and goals in maintaining the health and safety program of the organization. And we've seen this approach work in public organizations, private organizations, small organizations, multinational, multi-billion-dollar organizations. And just to close off, before we get to questions, Hitachi, through our experience in guiding organizations through this type of program, can help essentially get you started, which is a key question that we raised. If we spend a half a day with your leaders, we can understand the nature of the health and safety environment, the goals you want to achieve, and create a very high-level roadmap to get there, to identify key milestones, potential gaps, and the enablers that are required in order to achieve the health and safety outcomes that you need. And out of that, you'll achieve a roadmap, a high-level set of recommendations, and some key milestones and dates, so that you can drill down one step further and understand how to actually achieve the goals set out. And with that, I'm going to turn it back to Dinah.
Great, thanks, Rob. So now we'll head into our Q&A session. So the first question we have, bottom line, what works and what doesn't when helping organizations improve their safety performance?
So time and time again, what works is the ability to start and not stop. Once you adopt an approach to health and safety that's programmatic, that's based on data, that's based on active monitoring, begin small, create a success, take the success and create an enterprise-wide program, and never stop. Every day we come to work, every day things happen, and every day we need to actively monitor outcomes and situations. And success has always been those organizations that keep going, and keep going through good times and not so good times, and because at the end of the day, our environment, or the employees, these are the key parts of any organization.
Great. And our next question, how should an organization begin their safety analytics practice?
As you can see from some of the examples, is start small. You could start with one area of concern in an organization. I'll use the example of another client that had a sudden spike in sick days during flu season, and they recognized that their staff were not actually actively getting flu shots. And because the organization was a social services organization, their employees were in constant contact with the public. And so they created a policy that flu shots must be obtained within certain periods, and there were ramifications of not getting them. Then they monitored the outcomes, and sure enough, the number of sick days were reduced, and obviously the overall organizational health was improved, and their ability to service the community was improved. They then took that and said, let's look at overall outcomes around employee health satisfaction, their community client satisfaction, and they used that one success to create an overall health and safety committee structure, an ability to monitor and collect information.
Great, and I think we have time for one more today. So Rob, is success tied to any particular technology?
Emphatically no. What we talked about is not tied to the acquisition or ownership of any technology. What we talked about is tied to success. Success is really tied to creating that accountability structure, that programmatic and analytical perspective, and operational stance on health and safety. Technology today is an enabler of any program or business process we put in place. Buying any one specific technology is not a guarantee of success. Success is really governed by the people and their passion involved, the processes in place to collect and monitor information, and actively work on ways to improve.
Great, thanks, Rob. Well, this concludes our Q&A session. Rob, that was fantastic. Thank you for preparing this presentation and sharing your knowledge with us today. Friendly reminder to everyone that the details regarding our half-day workshop are available on your screen. My contact information is in the bottom left-hand corner, so please reach out to learn more about this great opportunity. To everyone who is watching today, thank you so much for joining us. That concludes today's presentation. Thanks again.